Officially, Myanmar says there are only a few dozen new infections a day. Observers say that can't be true. There's hardly any testing going on. There are reports of a lack of staff in testing centres. Hospitals have the same problem, with doctors and nurses joining strikes against the military, which seized power 4 months ago. There have been attacks on healthcare workers. As schools reopen, some teachers and students are also making a stand, defying the junta's calls for full classrooms, which would only help the virus spread. Hundreds of thousands of people across Myanmar have been calling for an end to the military takeover. The country is in turmoil, and the healthcare system is one of the worst affected sectors. Doctors and nurses were the first to go on strike, thousands refusing to work under a military regime. But that also poses a problem for COVID patients. Marjan Bosoyan is head of mission for Doctors Without Borders in Myanmar and joins us from Yangon. Tell us about the difficulties of your work, first of all. I mean, you're trying to save lives at the same time as putting your own lives at risk.
Yeah, that's true, and that's being part of MSF, I guess. At the moment, though, the threats on our lives is not very high. The situation for the people in Myanmar is very severe, but for the actual international staff of MSF, it's not. It is for our national staff a challenging period. Not only asking them to do more than we usually do, we are upscaling our activities due to the increased needs. At the same time, they're facing psychological stress from what is going on in their own country. So yes, for our staff, our national staff here in the office, we have around 1,100 people. It's a very testing time. But we are doing our utmost best to bring the services we want to bring in these times when we're witnessing a breakdown of a public health system here in Myanmar.
And I guess the psychological impact also has a political angle to it. The WHO is talking about 179 attacks on medical staff and facilities since the military took over. Also 13 deaths, dozens of arrests. I mean, how do you go about reaching the people when health professionals are being attacked?
Yes, specifically the health workers that are on CDM, so the civil disobedience movements are targeted. These are the health workers working for the public sector. You still have health workers working for private sector or for charity sector, like for MSF. So our doctors are continuing their work. They're not striking, and therefore they're less of a target directly. But you can see the fear among our staff as well, and that's basically from coming to the office, having to pass a lot of police checks, potentially being searched. There is definitely a fear. We are not directly the target because we're not working in the public health sector, and we are not joining the civil disobedience movement. But the national staff is definitely very aware and very tense, I would say.
Marjan, can you tell us just how dire the situation is with COVID, or how bad the numbers are? I believe the data isn't reliable.
The data is totally not reliable. So after the military takeover, basically the country stopped testing. The whole testing facilities, the vaccination program came to a standstill. There are a few hundred tests a day, but nothing but compared to before the military takeover, which means we don't have reliable data on the COVID. Which also means that we are in, besides the whole prevention, let's say, testing, tracing, vaccination, there's also a lot of things happening in the country that are conducive for COVID. Let's say the mass demonstrations, the whole banking system is collapsing. So there are long queues for ATMs, like really long. And in the region, in India and Bangladesh, there are varieties of COVID that are rampant. So we are really worried of a third wave outbreak in Myanmar with the health system at the current status.
Let's get another view from Georgina Phillips, an emergency physician in Australia who's trained doctors and nurses in Myanmar and has published a call for solidarity in The Lancet. Some of the authors of that letter have fled the country, are in hiding or have been detained. I asked Georgina, though, about the consequences of the coup for the people of Myanmar.
So the government health system has essentially collapsed as a result of the civil disobedience movement and the targeting of healthcare workers. So therefore, everyday healthcare systems are not available for the people, and people suffering from COVID, for example, are neither getting tested nor able to access emergency care. The consequence for healthcare workers is intimidation and arrest or fleeing the country. And so it's a health system in collapse. And during the COVID pandemic, now we can anticipate that there's a surge happening in Myanmar. The bordering countries are going through a surge. Mortality and morbidity statistics are not available. We don't know, testing is not available. We don't know how many people are positive. And people are frightened to go to healthcare services. They themselves might be targeted. The healthcare services are extremely limited. There's charity clinics, there's private clinics, but they're limited in what they can provide for people, and therefore we anticipate that people are suffering not only worsening of their normal health condition, but quite likely suffering from the escalation and surge of the COVID pandemic.
This wasn't always the way it was. Georgina, you mentioned before the coup that health facilities were in good shape.
That's true. So prior to the coup, the COVID response in Myanmar was quite robust. My colleagues in the emergency care systems in emergency medicine were leading the clinical response. The government hospitals had quite strong testing, screening, triage and critical care responses. There was a system for treatment, escalation of treatment, transfer of COVID positive patients. There was a robust public health response. People, of course, for a public health response, you need people to be trusting in their Ministry of Health and their government systems, and that was happening. There was contact tracing, and the vaccination program was rolling out. The military coup of the 1st of February has called a halt to all of those activities, and most of those things are no longer progressing.
The doctor I spoke to before said Myanmar wouldn't be able to handle a third wave. What is coming their way, do you think?
Oh, I think it's quite likely that there is a third wave happening in Myanmar at the moment. There's no available, reliable data. I think you can anticipate that is happening given the neighbouring countries, the situation of the neighbouring countries. And I do think that Myanmar will not be able to handle this surge. The government hospitals are barely functioning. Government health workers are very limited. The workforce is severely restricted, and the charity clinics and the private hospitals are not able to provide a service, and the people are most reluctant to attend the military hospitals. So in terms of accessing acute care for COVID for people with acute infection and serious symptoms, that will be severely diminished. In terms of contact tracing and the public health response, that's minimal. And the vaccination program, I think, is also severely restricted.
Time for Derek Williams and your questions on the coronavirus.
If some people can still get the virus even after being vaccinated, is herd immunity even possible?
Questions like this are why many scientists don't like the term herd immunity, because they feel the word immunity implies a point where the pandemic suddenly stops. A lot of them prefer the term herd protection, because vaccine drives don't make everyone in a population magically immune when enough people have had the shot. They just help protect people who are still vulnerable. Protection implies ongoing vigilance, which is what pretty much all the experts say we're going to need going forward. And there are a few reasons why herd protection will be very difficult to achieve. Not least that, as you say, a few people still contract the disease even after full vaccination and can presumably pass it on to others. This phenomenon is called vaccine failure, and the person it happens to is known as a breakthrough case. But data from the end of April from the US has confirmed something that had been reported from Israel, which is that breakthrough cases, at least so far, look exceedingly rare. That could, of course, change as more time passes, but right now, the data look great. It's a sign that herd protection might not be unachievable, at least in some local or regional or even maybe national contexts. But even if transmission is brought largely under control in some places, few experts believe SARS-CoV-2 is just going to go away, because to wipe out the virus, we'd have to hit vaccination goals globally, which will take years. And in the meantime, immunity could begin to wane in those who are already vaccinated, or the virus could still mutate in ways that would make herd protection even harder to achieve.